Hello to everyone and welcome to Executive Chat Live, the format of Bocconi University, where I have the pleasure to interview leaders of different industries and institutions. It's particularly important in these days because the topic, of course, is COVID-19, and the idea is to try to understand not only how much this pandemic is impacting society in these weeks, but more importantly, also to understand the impact that it will have in the years to come. And this evening, we have the pleasure to discuss about a fundamental topic, which is the life sciences. So basically, we'll be speaking about the industries that impact our life, which are crucial, at least for two reasons. First of all, because we have seen their impact in these days. They are clearly at the baseline of the Maslow pyramid, because they have to do with the most important thing that we have, our life, and therefore we really need to understand more in depth their implications when it's about having an exogenous shock like a pandemic like this one. But then they're crucial also because these are industries that represent an engine for growth and for innovation. And as a matter of fact, the investment in research and development in these industries is one of the most important in terms of cumulative investment, and it's crucial for the growth and so for also for the years to come. And this evening we have two distinguished guests, and so it's a real pleasure, of course, to introduce them. And so let me get started with Professor Alberto Mantovani, who is the scientific director of Humanitas Research Hospital in Milan.
Good afternoon. It's a pleasure to be here with you this afternoon.
Thank you very much. Professor Mantovani is worldwide known for his contribution in the field of immunology. He has contributed to the advancement of knowledge by identifying new molecules and new function. He has received several awards, including most recently the American Association for Cancer Research Pescoler Award for Extraordinary Achievements in Cancer Research. And we also have the privilege this evening to have Mr. Carlo Rosa, who is the Chief Executive Officer of Diasorin.
Good afternoon, and thanks for inviting me.
Mr. Rosa is a chemist that devoted his career to research and development in the United States and in Italy in different institutions, and since 2006 is the CEO of Diasorin, an Italian multinational group and a global leader in the market for in vitro diagnostics. So let me get started with a question to Professor Mantovani. Professor, after 5 months from its official appearance, can you share with us what is COVID-19 really?
Well, let me start with a quotation from the Greek philosopher Socrates. He stated, "I know that I don't know." Well, I'm aware that I know very little, even of the immunology of COVID-19, but we have made tremendous progress, and progress has impact on diverse aspects of this challenge. Well, first of all, the virus was identified very quickly. We now understand that it interacts with the lungs and upper airway. This is kind of a surprise. It also, we find the virus at other sites, perhaps even in cells of the immune system, in monocytes, the first line of defense. Then we have data suggesting that in people who become ill, the virus skews the response away from an antiviral response. The adaptive immune system, the more sophisticated system, then comes in, and we are starting to understand the T cells, the directors of the immunological orchestra. And here again, there is data suggesting that there is cueing to inappropriate responses that are wrong to fight the virus. B cells, the cells that produce antibodies, come in very late. And this altogether triggers an uncontrolled inflammatory response syndrome. And this is what we see in the patients. It's a macrophage activation syndrome, a cytokine storm, and coagulation abnormalities. And this is really the challenge. And it has, and this current understanding of us, which, as I said, is limited. There is a long list of things we don't understand. But what we understand has profound implications in terms of lifestyle, ranging from lifestyle to diagnostics, to therapeutics we are testing, and to vaccines. For instance, one of the unknown aspects is memory. How long does immunological memory last? So we have plenty of work to do.
Very interesting. So very unique. And so my question goes to the industrial side of this enemy we are fighting in these days. Mr. Rosa, have we ever fought something like that?
The obvious answer is no. No, we didn't. And although I think what we are getting out of this is, in my opinion, very reassuring. If you think about it, within weeks, we were able to isolate the virus, sequence the virus, and within months, we were able to develop diagnostic tools that really help community isolating patients, which was the first issue that really hit hospitals. And now also to try to sneak out in the normal population, general populations, those individuals that have been asymptomatic, paucisymptomatics, that have encountered the virus, but they were either not diagnosed or because of the symptoms or because of the lack of capacity of the industry. One remark, in my opinion, has to be made, and notwithstanding the fact that the whole industry really spent an enormous amount of resources in developing tools. I just want to give you a number which should make all of us think. In the US every year, 4 million tests of molecular HIV are done. In the US every year, 50 million tests of influenza virus are actually done. And now we are talking about 10 million tests a month of COVID, just for the US, with the ambition of the US government to grow that capacity to 100 million tests per month. And this is the challenge. This explains why today people talk about we don't have enough swabs, so we don't have enough capacity in the industry, because the challenge of the scale up is phenomenal.
This is really incredible. And the good news is that how science and how the evolution of the species, if you allow me, is really catching up also in terms of instruments to fight it. And you mentioned, Professor Mantovani, before the vaccine. So how far we are from a solution in terms of vaccine?
Well, first of all, let me say that we never generated a vaccine against the coronavirus. So we are charting the unknown. We should be aware of that, in spite of the fact that there are at least 4 coronaviruses that cause cold, the common cold. So we are faced with a challenge. There are about 100 hypotheses of vaccines in academia, in industry, or joint ventures between academia and industry. And I think that this is extremely positive because of the challenge we have. In addition, we may come up with more than one vaccine. And again, I think that this is healthy. We should not forget that we have 2 vaccines against polio. And they are used in a complementary way, depending on the context. Of course, there are about, we all know that there are about 10 vaccines that are at the stage of phase 1 trials in healthy volunteers. One in China, one in UK, one in US, and we hear the news about that. And there are hints that they may induce immunity or at least antibody production. So I think that I'm optimistic that we will get a vaccine. If you make a prediction, you are pretty sure that you are going to be wrong. But I expect that we will need about 12, 18 months to get a vaccine. We should not forget that the concept of a vaccine is relatively easy. It's relatively easy to run the first assays, but the real challenge is then manufacturing. And there is a challenge there because, of course, we need to think of vaccinating the globe. hundreds of millions of people. We have an issue of safety at that stage, and then we have an issue of equity. I've served in a global alliance for vaccines, Global Alliance for Vaccines and Immunization, Gavi, that the scope of Gavi is to reduce infant mortality rate. 1.5 million children die because they don't have access to the most elementary vaccines. And here again, we are going to have an issue of equity in vaccine share. So these are some of the challenges ahead.
Absolutely, which brings in also the complication of the different health systems that, for which, of course, sometimes health is a luxury, like it is happening in some Western countries in these days. Other countries, fortunately, like Italy, it is not, but this is for sure a major challenge for the future, which has not only to do with the technology, but also with social sciences. And Mr. Rosa, speaking about instead the diagnosis of the problem, Diasorin was one of the first companies, actually in many countries the first one, that was able to develop a test. So can you share with us the secret of this success?
The secret sauce of Diasorin is, I think, is relatively simple. As said, from a technological point of view, the technologies that were used to set up those diagnostic tools are the same ones that we've been using for 140 different products that we have on the catalog. So technologies were available. I believe that what worked for us, unfortunately, is the fact that after China, Italy was the second country to be hit very hard. And if you remember, 3 months ago in Roma, the Spallanzani Hospital, they were able first to isolate the virus. And having the virus isolated provides us a tremendous advantage in the ability to set up a molecular diagnostic product, which today everybody calls a swab, but it's a very complex assay that requires to be developed, the viability of live viruses, which they had at the Spallanzani in Roma, if you remember. But in Roma at the time, they didn't have patients. Again, there were 2 patients, the 2 famous Chinese that very recently have been released and sent back to China. But unfortunately, in Codogno, in Lodi, so very close to where our research center is in Italy, you started to have lots of cases that were actually directed to 3 primary hospitals in Milan, one of which was the San Matteo Hospital in Pavia. And so we had a viability of hundreds of patients where we could test and verify the performance of our products. And that gave us, I would say unfortunately, but gave us a leadway in the ability to take a product, validate a product, and then take a guarantee safety, and then release the product on the market. So in summary, combination of technologies built over 30 years in the company and proximity to the clinical centers that had patients so that we could test our products there.
But also, I would add also the agility of doing that, because we have many companies that have good experience, good proximity sometimes to customers or problems that are important to their business, but they are unable because they have rigid systems. So I assume that Diasorin is also very agile as a corporation.
Well, if you define agility as the fact that you have an ongoing number of R&D projects. Today we have roughly 150 people working in R&D, and they were taking care of 15 different R&D projects. And all of a sudden, one day, you make an executive decision to cancel all of them and take all the resources you have and put them to work on COVID, hoping that within 8 weeks, you're going to have a product. Yeah, that's the best definition of agility. Certainly, a company of the size of Diasorin does have that flexibility, but I also need to remind you that, to my own surprise, companies of a bigger size, and I'm talking about Roche, and I'm talking about Abbott, so companies that are very large companies, were able within 3 months, not 2, but 3 months, to come up with products. So I think that when there is a state of pandemic in the organizations, all of a sudden, all the processes that have been set up in years and sometimes are borderline to bureaucracy, all of a sudden becomes completely reevaluated versus the fact that you want to get a task done in 8 weeks, and eventually everybody gets there.
No, I guess that is absolutely true, and this happens also in the case of universities where Professor Mantovani and I typically live. We have had to transform ourselves into digital corporations overnight, basically. And let me get to you, Professor Mantovani. Basically, I would say for the first time in years, I really don't have memories of science being so much influential to politics. So we said at the very beginning that life sciences particularly are crucial to politics because, of course, health is a fundamental good that we have to preserve. And so every year, of course, there is the budget and we have to spend money for this specific good. But, science has become really, has caught the headlines of all the papers. We see Dr. Fauci every night with Donald Trump. So it's really about this interaction with politics, which at least to me was completely unusual. So I would like to have your view on this. I find it very positive, but I would like to know your viewpoint in terms of what you have seen of good and bad out of this interaction.
Well, the good side is that science is needed. People realize that you need science. But we have to do our job and politicians have to do their job. And so I think that I do respect politicians when they don't make statements such as I take a pill of chloroquine every day, and that's inappropriate. That kills. That kind of statements, we should be blunt. That statement kills people because people then start taking chloroquine, and there is evidence that inappropriate usage of chloroquine or hydroxychloroquine has caused tremendous damage to people who suffer from heart problems. So that is not what I like. I think that we should provide the information, in my case, the immunology, provide the information, and politicians have to balance. For instance, we have an economic crisis. There is plenty of evidence that poverty kills, that poverty translates into health problems. There is plenty of evidence that cultural poverty, and I'm very worried about what is happening in education. Cultural poverty is even worse than money in terms of translating in bad health. Sure. So I think that the duty of the politicians is to take decisions, take some risks, and balance pros and cons. And each of us has to do our own job. Tony is doing his own job in a fantastic way, and then the politicians have to take their responsibility. That's my general view.
Yes, makes a lot of sense, and I fully agree with this. Mr. Rosa, what is your opinion on what you are seeing in these interactions, even in Italy and besides the US?
Look, besides the fact that I think Dr. Fauci is a hero, he's sitting on a job that I would never take these days. But said that, I would like to actually make a comparison between what the US is doing and what Europe is doing. And I'm telling you right away that I think that the US is doing the right thing and Europe is not going in the right direction. So what is the US doing? The US recognized that there is a problem, and the problem has to be faced by products. Research, unfortunately, in 8 weeks is not going to give you a solution. So you need to bank on the fact that research has been done, and then companies bring products to help to the market. And what the US did was they called everybody. They called the companies that could make a difference. And I'm not talking just pharmaceutical and diagnostic. They called to the table logistic companies. They called to the table the aviation industry. And they said, guys, the only thing that the government can do, they can put money at your disposal. But then what you have to do is you need to take all the resources you have, forget about what you're doing, and just do something that is helping the community to face the pandemic. And to be honest with you, I believe it that that Anglo-Saxon way of looking at a solution right away for a problem is the right way to do it. And I don't see this in Europe. Without really pointing finger, I don't see Europe actually doing the same. I see Europe getting in more philosophical debates. And this is what I think is the tremendous difference between the ability of a country like the US to respond versus the way Europe has been responding to this crisis. And I have to say that if you look at the economic resources that the two, so US on one side and Europe on the other side, would be able to put on the table, the difference is not the amount of money. The difference is how one country united around the problem is tackling the problem versus 28 countries are discussing what to do. And this, I think, is the take-home message for Europe, is a tremendous opportunity to change the way we think, because one thing is for sure, we cannot face another pandemic this way. I think is a lose-lose proposition.
This makes a lot of sense, and in fact, collaboration is crucial within Europe, even in terms of scale and size, given also the states of the European Union. And speaking about these elements of integration, one element that characterizes both science and industries in these days, when it's about research and development, so when it's about basic research and applied research, it's really the increasing need of cooperation and collaboration. So knowledge is becoming more complex, and so we more and more need, of course, the integration and experience of other institutions besides the one where we are trying to develop a new product or a new paper. So my question, specifically related to this pandemic, is to Professor Mantovani. What do you think open science is going? So is it going in the right direction? Are we cooperating enough to solve puzzles like this one? And which are the instruments that we should implement to be faster and to even be more aggressive in finding a solution?
Well, at a personal level, in the last 4 months, I experienced the level of integration and collaboration, sharing of data, sharing of information, of unpublished information, sharing of ideas across the world. I mean, at a level that I never experienced in my professional life. And I have had a pretty long professional life, I'm afraid. I mean, yesterday, as of yesterday, I was on a call that involved New Zealand, Australia, Germany, US, Canada, and I'm probably forgetting someone. So this, again, it's something unprecedented. The very way we are communicating science is unprecedented. Of course, we are relying on peer review and journals, but in parallel, we are more and more relying on access. And perhaps there is too much information to digest. That is a risk. So I think that at this level, it is unprecedented. And this level, for instance, let me give you an example. We have had for 5 years a former collaboration with Wuhan, so the center of where everything was born. And we have had a very open discussions and very open interaction with people in Wuhan. At the same time, I see barriers being raised all over the places in Europe and across the world. I mean, chloroquine is I'm using chloroquine as an example. Then we are not going to export chloroquine. So that is a matter of concern for me in terms of translating science to the benefit of the world. That is, but I think that we are going. Things are not going back. We are not going to do business the same way we used to. So I think it's perhaps the only or one of the very few positive aspects of the pandemic.
Yeah, that's very, very fascinating and very important in terms of future directions. And of course, I would like to hear the words also of Mr. Rosa with this, who is on the business side. And we know, Schumpeter told us that entrepreneurs have to make profit, right? Because otherwise it would be an investment of the state. If you don't make a profit, you don't have incentives. That we call it incentives in economics. So open innovation, and so this is a paradigm of open science, which translates in R&D in terms of open innovation, is something which dilutes when it goes down the pipeline, or can be as important as in the case of science?
No, I think that is fundamental, especially for challenges of this size. We have recently announced that we are working on a new product that should be a substitution for the current swab system, the tamponi, as we call it in Italy, that are providing dramatic challenges today in terms of manufacturability, as we discussed before. And to do so, we decided to partner with another company in the US, and this is because the way that we want to design this product is a test to be done on saliva. We don't know saliva because we work with blood. They are worldwide leaders in saliva, and so we decided that to make this challenge, you need to take the competence of two companies, bring it together, and then develop innovation. And what is very interesting is that with Professor Mantovani, in the same project, we decided that there is a clinical component. And so you have companies with technology, you have a research center and a hospital that understand the clinical aspect, that understand the immunoresponse. And again, the decision was if we want to really bring to the market innovation within 3 months, what do we need? You need technologies from two companies, and you need somebody who understands the clinical need. And in this case is Professor Mantovani Institute. So this to me is the perfect example where these elements come together in order to provide a solution for a problem. But also is a matter of respect, because when you work with an institution, a research institution like the one of Professor Mantovani, you also need to respect the fact that there is a profound interest in basic research. The ability is to have a mutual respect about getting more knowledge on the table, and however, getting a product out in 8 weeks. And I think that we will be able to do so working together, taking scientists and taking industrial scientists and driving them together toward a common goal.
Sure. And there is a question from the audience asking, the major differences of the approach of open innovation across different countries, and in general, the interaction between public and private. So I would like to ask Professor Mantovani, but also you, Mr. Rosa, what do you think we could do to improve this interaction, particularly in the case of Italy? The United States, the interaction between universities and companies is in terms of scale, of course, but also in terms of tradition is probably more fluid. What are the core obstacles to improve in Italy, but also in EU in general, besides what Mr. Rosa said before in terms of integration of EU?
Well, I fully agree with what Carlo Rosa said. I mean, the real discriminant is quality, is patient care quality, scientific quality, innovation quality on the side of industry. And I think from the point of view of the country, there is a strategic need to foster research and innovation, capitalizing on the background of the country in terms of diagnostics. And I'm not saying this because Carlo Rosa is here. This is what I believe. Diagnostics, pharmaceutical companies, and vaccines. Let me remind everybody that we are very good innovators in the field of vaccines, the adjuvants, for some of the vaccines are going to be made in this country. We have a strategic interest in promoting that. And in addition, billions of people have been vaccinated by vaccines manufactured in this country. So I think that fostering quality and productive interactions between the private sector and academia or private public, I think, is strategic.
Okay. And were you, if I may, Professor Mantovani, the Ministry of Research, would you do something specifically to nurture this interaction? So I'm thinking about even different mechanisms with respect to what we have done so far, given that there is a lot of frictions, a lot of inertia.
It gets, I mean, years ago, a bunch of us who happened to be highly cited in the scientific literature, we called for removing, in Italian we say lacci and lacciuoli, I mean the bureaucratic aspects. And I have funny stories about that. Well, not really funny, tragic stories about that. So that is, I think, the first thing to do.
Sure.
Then, of course, we need flexibility. Flexibility was already mentioned. We need to foster, I mean, it's physiological that you have a bottleneck between fundamental science and translation, but all data suggests that the bottleneck is all too small in this country if you make comparisons. So you need to foster that aspect. And in addition, you need to have a reliable front desk for basic research. A reliable front desk with grants. We are relying all too much on philanthropy. And on a small scale, for instance, Fondazione Cariplo in the Lombardy region, top down, put money on sequencing of the virus. And of course, now there are discussions about whether the virus has changed, has become more benign. I believe there is no data for that, and that can be dangerous, can be conducive to irresponsible behaviors. But we top down, as Carlo said, we said, you are able to do sequencing, please go ahead, do sequencing. We need that information. Sure. So we need to be able to do that in a transparent and responsible way.
Sure. And Carlo Rosa, in your case, you are a multinational with projects in different countries. Do you choose also where to start, also according to these problems, such as bureaucracy, or sometimes, it's just about, serendipity, and as you said before, proximity of problems, which make you start first in a country versus another? What do you do as the CEO when you have to, of course, engage different projects from a plethora of markets and industries?
We usually go where competence resides. That's a very obvious statement. But I will say something now that is not popular, but unfortunately is the reality. In the US, there is a culture also at the university that translating basic research into profit, into companies, is not a bad thing, right? And this explains why in different fields you do have lots of startups. And it certainly is a combination of a lot of VC money that is available in the US and the ability to risk more than we do in Europe, but also is a mentality that you find in the US. So the technology transfer and the ability to make of a technology a product and money is a part of the culture. And this is unique of that country. And if I need to look at Europe, is very different. And I think that is a matter of a generation. And I see now more on the engineering side in Europe that it's getting there. So engineers are more prone to think about, can I make a product? Can I make my own company? In life science, you have it. You have it in certain countries. You have it in Northern Europe. You have it in Germany, better than other countries. You certainly have it in England. What I see that we need to make an effort, but I believe is it has to be part of the education of the students in the schools, that you can go through academia, but at a certain point, you can take the risk to leave that post because you want to bet on the fact that you're going to start your own enterprise. And we are still lagging behind in Southern Europe and in Italy regarding that.
This is absolutely, I don't know whether Professor Mantovani agrees. In my view, this is something I absolutely also agree with. It's a cultural issue, I would say also. Probably, I think in the Anglo-Saxon culture also, becoming an entrepreneur is also more natural. There is less risk aversion, and in general, that's true. Scientists oftentimes they like to patent and they like to make their own company. This is also the secret, one of the many secrets of the Silicon Valley. Absolutely, absolutely. And may I ask also another $1 billion question to Professor Mantovani? What's next for the life sciences? So, what are the core opportunities and challenges that we are going to face in the near future?
Well, well, of course. It's always risky to predict the future. I mean, you're almost sure that you are going to be wrong. But I do believe that a key word for the future is contamination. In other words, getting contaminated between disciplines and bench and bedside. For instance, engineering. Engineering was mentioned. Engineering and biomedical sciences, and we have an initiative together with Politecnico in Milan, a medical school, which is both an engineering and conventional medical school, because we feel that the future is there. Then a couple of years ago, Rino Rappuoli and myself had a paper in Journal of Experimental Medicine about vaccines, and our statement was that vaccines are a human right and a safety belt for safety belt and insurance for humankind, and of course we were right. But the final message of the paper that Rino and I wrote was that integration of epidemiology, biophysics, conventional immunology is still there, is key for the development of innovative vaccines. And I think that this is broadly right for life sciences.
This is fantastic. And by the way, one of the person in the audience was asking whether you think that this pandemic is also impacting on the way we perceive the importance of vaccines. So do you think that in the future will be less, let's say, anti-vaccine, but more importantly, we will, try to use prevention. What is your take with this?
Well, I do hope that we have a sense of what is a world without vaccine, without a vaccine. And of course, for instance, I'm old enough to remember polio. I just had a sense of polio because one of my schoolmates had a limb affected by polio. But I have 8 grandchildren, and I have 8 grandchildren. They have, or my 4 children, they don't know what polio is. Sure. They may believe that polio is gone because the polio virus decided to leave, but this is not the case. So now we have testimony that vaccines are essential. I doubt that this will affect the feeling of hardcore no-vax people, but I do hope that this will affect the feelings of the gray zone. I think that people now realize that we do need vaccines.
Sure. That for sure. And Mr. Rosa, what is your take on the challenges for the future of life sciences from your laboratory?
I think the challenge is that we need to rethink the way we deploy the healthcare systems in the territories, because I think that we are facing a different degree of complexity. On one side, technologies that are complex and expensive, and they have to be centralized. And so you need to think that you have a smaller number of reference centers which are fully equipped with the technologies and the experience, and they see enough patients coming through that experience can provide the best care for people. But by the same token, I think that what this is showing is that you need to invest more in decentralization. And decentralization means that you need to really educate physicians that are available, understand the community, that are embedded in the community, and you need to provide them tools like certain diagnostic tools that allow them to intercept issues like this at the beginning of the story, because we have seen that if you catch it too late, then you end up spending your weekends in a lockdown until somebody finds a vaccine. So the challenge, but I also say the opportunity for Italy would be to take what we have, our healthcare system, which is phenomenal, I believe, and following technologies, change it within the next 5 to 10 years, build certain infrastructures to make it ready for the next one, because I believe that statistically, we have seen these viruses popping up. And in this very specific case, they will be very unlucky, but you cannot bet the future of 7 billion people on luck. And I think the take-home message here is that we need to invest in a healthcare system to be ready next time, and in the technologies necessary to fight the situations that are occurring today.
I have one more question for you and one other question from the audience for Professor Mantovani. Mr. Rosa, one person in the audience was asking how, let me reinterpret the question to make it even more complicated. How can a CEO in the pharmaceutical industry, where whenever you declare something, of course, you have stocks going up and down, how can you, avoid thinking about stocks and stay, firm on the business to think about what's good to do? So how can you do it? Do you see these fluctuations? You don't care about them? What is about the essence of being a CEO in a company which is public?
Look, I think we can have another long discussion about this, but I'm gonna cut it short for you. I think that I am a very lucky CEO because I work for a public company, but I have a core shareholder. So I do have someone that owns, that controls the company, that share with me the mid-long-term view and doesn't really care about what is going to happen in the next quarter. And again, we can have another discussion about truly public companies versus private companies versus semi-public companies. But I think that, and I've seen that if you truly are a public company and you need to face your analyst on a quarterly basis, yes, the temptation to go after the slogan is incredible. And you have seen how much damage that has done. If you're in a lucky situation like I am, when I talk to my shareholders about what we need to do for the next 5 years, then you make the right decisions and you don't enjoy or you don't suffer if the stock is up 30 or down 30%. So I am in a certain way an exception in the world of public companies.
Okay, so thank you very much. Professor Mantovani, very last question from the audience, which is about the complexity of getting a vaccine effective and safe, given that the virus is changeable. I mean, is it really mutating from what we understand so far? And how much is complex if, of course, it has mutations?
There are about the last time I had a look there are about 5,000 complete genomes of the virus sequenced. And the virus so far has been relatively stable. In essence, there are 20 mutations. And there's been a discussion about one particular mutation being able to render the virus more aggressive. So the data so far are reassuring. This is not HIV. I mean, of course, we failed to get an HIV vaccine so far because of the instability of, a major reason is the instability of the virus. And here, the virus is relatively stable. There are complementary and different approaches, nucleic acid-based approach, which are faster, and those are the ones that we get news about volunteers making antibodies, high levels of antibodies or levels comparable to those of people who recovered from the infection. And that is a fast pathway. And then there is a more traditional pathway with proteins and adjuvants. And that is a slower pathway, but it has there are pros and cons in the two approaches. The pros for the first approach is speed in the first phases. The pros for the second approach is that there are well-established manufacturing facilities all over the world. So it can presumably be deployed on a large scale. This is an oversimplified view, but these are complementary approaches.
Well, really, I think the time is over now. And so I would really like to wholeheartedly thank you for this very insightful conversation. Thank you, Professor Mantovani.
Pleasure to be with you.
And thank you very much, Mr. Rosa, as well.
Thank you. Thanks for the invitation again.
We have learned many, many things, but for sure, this is a unique pandemic which represents a unique enemy for the industry. And the good news is that we are also introducing many innovations, both from the scientific and industrial world. And we are changing, if I may summarize also very briefly, the way we behave, not only individually, but also from the organization and societal viewpoint. And let's hope that this will impact positively our society. So thank you very much and have a great evening.